We can go ahead and get started. Well, welcome everyone. We're excited for you to join us here for the fifth of six listening sessions on the region's food system that will help inform the 2021 Food System Action Plan. This meeting will be recorded and we'll follow up with an email that includes resources, a link to the recording, some materials that's been shared here, and ways to stay engaged. I'd like to thank the Sacramento Region Community Foundation for their support that has enabled us to host these sessions and update the 2015 action plan. I know that Linda Cutler was not able to make the call, but Kathy, I see that you're on. Do you want to make a comment before we get into introductions?
I just really want to thank everyone for being here today. Sorry I'm not on camera. My kids are some noise in the background. But thank you, Bell Vision, for putting this together. Looking forward to all of your input in today's session. Thank you.
Thank you, Kathy. And with that, we'll move on to introductions. So for those of you who have been here before with us on these listening sessions, it's the similar format. So we'll do name, organization, and then what project or activity you're working on as it relates to health and nutrition in our food system. So first, I will start out with Amber Stott.
Hello, I'm Amber, and I run the Food Literacy Center. Our mission is to inspire kids to eat their vegetables. And so we are working on cooking and nutrition classes. Through COVID, we provided take-home recipe kits for families to cook a healthy meal with their families. And we are about to open a 4,500 square foot zero net energy cooking school at Leotata Floyd.
Thank you, Amber. And Becca Whitman.
Good morning, everyone. Becca Whitman with Rayleigh's. Happy to be here. We work with our community partners and gosh, lots of nonprofits, a lot of you on the call. Our goal is to alleviate hunger and also change the way the world eats one plate at a time. So this is right up our alley and we're excited to hear what everyone has to say today.
Thank you. And Brenda Ruiz.
Good morning. This is Brenda Ruiz from the Sacramento Food Policy Council. Let's see, in my other functions with Grant High School and Luther Burbank, I support the career and technical education components of their urban garden and natural resources education by linking that programming with seed to plate cooking, culinary, and nutrition education. The Food Policy Council supports the Sacramento County Health Department in implementation of its environmental justice objectives, which includes health, nutrition, food security, and food access, as well as some other health policies that are not necessarily food related, but related to the built environment.
Thank you. And Chelsea Miner.
Good morning, everyone. Chelsea Miner with Rayleigh's. As Becca noted, your favorite local family-owned grocery store with a purpose of changing the way the world eats. A lot of our work in terms of our aisles and how we're functioning our grocery stores is around education and transparency and empowering our customers to make the right choices for their personal health journeys. So very excited at the leadership of the Sacramento region and how we might fit and play into that.
Thank you. And I know that Christy had mentioned that that the audio might be a little messed up. So I don't know if you're able to unmute or if it's too loud, Christy. If not, if you could just share in chat what you're working on in your organization. And we can move on to Jennifer.
Good morning, everyone. I'm Jennifer Duran with the Health Education Council. I assist with our food distribution programs and we provide nutritious meals and produce to families in need.
Thank you. And Joe? Robustelli?
Yeah, good morning. I'm Joe Robustelli with Alchemist CDC, and the programs I'm in charge of are the community gardens. So we currently have one with 17 plots that is operational in North Oak Park. Another one that will have 8 plots that is currently being built in Central Oak Park, and then a big one at the new Marisol Village project that will have about 60 plots. So it's a huge one. And then we also run the CalFresh program at farmers markets.
Great, thank you. And Kate Still?
Good morning. My name is Kate Still, and I am with Nugget Markets, Chief Impact Officer. I'm also currently the chair of the Sacramento Region Community Foundation, which is a big part of this project that we're discussing today. And I'm also a board member of the Yolo Food Bank. So not only am I, but our company of Nugget Markets, very involved in this space of nutrition, education, food insecurity, and the whole larger space in a multitude of ways, and with a number of different partners throughout the region.
Thank you. And Lori Sommerhausen?
Good morning, everyone. My name is Lori Sommerhausen, and I'm with the Yolo County Women, Infants, and Children Program, otherwise known as WIC. And so we've been madly over the last year and a half switching from in-person to virtual nutrition and breastfeeding education. So we continue to look for creative ways to get our messages out to our clients, as well as ensuring monthly that their prescribed foods are available to them. I think we've done a pretty spectacular job of making sure that their benefits are in their hands and able to use at all of our grocers within Yolo County. Additionally, our participants are now receiving a higher value of cash towards fruits and vegetable purchases. So working on our increased messaging about that, that's increased from $9 or $11 per person to $35 per person. So incredible buying power in the region for all WIC programs, not just our little region. And then it's also farmers market nutrition program season. So issuing our farmers market coupons, and we're going to pilot doing that on site at farmers markets in Yolo County to ensure that we have a higher redemption rate. When we had to do it by mail last year, we did see a very, very small redemption rate on that. So we're hoping by issuing them at the market, they'll be able to purchase right then and there, and we'll see a better redemption on that. Thank you.
Thank you. And Linda Cutler, I'm happy you're able to join us.
Hi, everyone. I'm sorry I jumped on a little bit late. I'm the CEO of the Sacramento Region Community Foundation. And as may have been mentioned earlier, we are funding this project. We funded the original project in 2015. And so we're so much has changed, obviously. So we're thrilled to be able to support this update in partnership with Valley Vision and so many organizations in this region. So thank you for your participation and your very important input to this.
Thank you. And Lucia Kaiser?
Hi, thank you. I'm a retired community nutrition specialist with UC Davis and UC Cooperative Extension. And over the past 5 years since I retired, I've been volunteering and now currently I'm involved with the Yolo County Food Security Planning Group, which includes nutrition education. And I also work with the Yolo Library as part of the Yolo Reads program, which is building literacy. And as part of my work there, sometimes it involves health and nutrition literacy, as well as English literacy.
Thank you. And Megan Holdaway?
Hi, I'm Megan Holdaway. I'm a registered dietitian, nutritionist, and project manager at Dairy Council of California. We're a nutrition education organization, and we work directly with educators, food service professionals, health and wellness providers, and community leaders to provide trainings, support, and nutrition education resources to teach the importance of nutrition and how to eat healthfully And I've recently been working behind the scenes on the Well Nourished Brighter Futures initiative, which recently launched. We're working with partners locally and throughout the state to find realistic and actionable solutions to improve children's health with a focus on the first 1,000 days of life. So I'm happy to be here. Thank you.
Thank you. Michael Bish.
Good morning. My name is Michael Bish. I'm the executive director of Yolo Food Bank. We have been pivoting since early last fall to focus increasingly on advancing metabolic health to the folks that we serve, and less focus on distributing pounds of food. There's a number of individuals on this call that we're hopeful will be able to provide really critically needed assistance in that pivot. And we'll see where that effort goes.
Thank you. And Neka Uba?
Hello, everyone. My name is Neka Uba with Health Education Council. We have collaborated with various food banks to help offer food bank items to low-income residents across affordable housing sites. We've also helped collaborate with a nonprofit in Placer County to offer nutritious meals, locally prepared nutritious meals to the low-income residents in their area as well. And then also we have also included like healthy recipe cards in the bags, and also in the food boxes as well. Thank you.
Thank you. And Pua Mua?
Good morning, everyone. I'm Pua Mua, manager for our community health and outreach with Dignity Health. I'm just here to listen. One of our, of course, key health priorities is active living and healthy eating. So just here listening to the current landscape.
Thank you. And Raj Samra?
Yes, good morning, everyone. My name is Raj, and I'm the CEO for eCenter. We administer and oversee the WIC program in Lake County, and we also oversee the Head Start programs in 8 counties here in Northern California. I'm also the chair of the Yuba Sutter Food Bank. Excuse me, sorry about that. And we are really focusing on how we can deal with some of the issues that have come up during the pandemic and continue to support families on building healthier lifestyles, how to get access, how they can have better access to nutritious food, and working with local farmers and vendors to be able to supply that here locally in our community. We also operate 3 commercial kitchens and serve over 2,000 meals a day. So, we have a little bit of everything. And of course, reiterating what was said earlier by the executive director of the Yolo County Food Bank, working with our food bank to really assess waste and reduce food waste, and to have other collaborative opportunities where we can address the needs of our local communities.
Great, thank you. And next we have Renee DeVere-Oki.
Great. Good morning, Renee DeVere-Oki here from Sacramento Area Council of Governments. I'm our Rural Urban Connection Strategies Program Manager, which basically means we focus on some ag and natural resources. We're currently working with Trish and Grace on a project called Coordinated Rural Opportunities Plan, kind of looking at opportunities to how to integrate our land use and make some of these connections with our local assets that we have, as well as connecting them to markets. So interested in learning a little bit more about the health and nutrition aspect. Thanks.
Thank you. And Sarah Bernal? Sarah, are you there? She might be on the
Sorry about that. I'm so sorry. We're out at the farm harvesting right now, so it took me a second to get unmuted. Sarah Bernal with the Center for Land-Based Learning, West Sacramento Urban Farm Program Manager. We are focusing on our pilot of our mobile farmers market, which is delivering our local produce from the urban farm program over to affordable housing complexes and partnered with Health Education Council and Yolo Food Bank and Health and Human Services to provide supplementary items and recipe cards to residents. Thanks.
Thanks, Sarah. Sean Adams.
Hi, everybody. This is my first time, interacting with this group. I'll probably be a little bit of a fish out of water. Hopefully you'll allow that today. I'm the scientific director for the Center for Alimentary and Metabolic Science here in the Department of Surgery at UC Davis Health. And what our center is attempting to do, our mission really is to consider the science that underlies metabolic health and nutrition and dietary patterns. So if it comes to a physiological measurement of any kind that involves, dietary patterns, gut microbiome, endocrinology, metabolic health, physical activity, we're kind of a go-to place for that. We're also doing our best to serve as sort of a catalyst, working with Department of Nutrition and other partners on campus, including the USDA, to conduct both sort of basic and clinical research, but also community-facing efforts as well. That's the long-term goal, including things like personalized nutrition. And more recently, last thing I'll say is we are championing here on the UC Davis Health campus something we're calling the HEAL ecosystem, which is healthy eating and lifestyle ecosystem, which will hopefully combine sort of the basic science folks like myself with community-facing programs and other collaborators who might be interested in this. Ultimately, there's also discussion with Department of Nutrition and others for developing a culinary medicine program, which is a bit of a dream, but it's something that we think we can do. And we also don't want to forget physical activity, because I think physical activity and nutrition sort of go hand in hand. So excited to be here. Thank you.
Great, thank you for joining us. And we have a number calling in at 619-578 number. Are you able to unmute? It looks like you're unmuted, but we're not hearing anything. Okay, well, hopefully we can hear from you later on. If not, the Mentimeter exercise allows for to handwrite, responses in. And last but not least, Trish Kelly.
Good morning, everyone. I'm Trish Kelly, Managing Director at Valley Vision. Was involved in the 2015 Food System Action Plan and really excited to be working with everybody on this update. Very grateful to the Community Foundation for the support, and I've worked with many of you over the years and really happy to see some new faces here as well. So thanks, Grace.
All right, folks, and so what we are going to do right now is head into our first Mentimeter exercise. So if you're calling in from the phone, you can go to menti.com and enter in the code 6943-5914. Again, that's 9643-5914. And anyone who's joining us either from your smartphone or computer, you can enter in the link I just posted in chat. And we just want to get an idea of what sector we represent here. And I'll share that screen so we can all see the results in real time. We'll be using this service after Trish's presentation and background of the food system to get some more ideas from you all about health and nutrition in the food system. So it looks like we're split right now between, we have more nonprofits coming in, some local government and private sector, one with the general health and nutrition, and then academia. So I'll keep this up so you all can still, get used to the system and get acclimated to it and enter in your sector if you haven't already. But for now, we'll exit out of this screen and go into the presentation so that Trish can start.
Thank you very much, Grace. I wanted to give an overview about the Food System Action Plan and the process, what we're striving for, what our process is going to be over the next few months, and then give you a little bit of background around our food system, that we're all kind of working from some shared information. And then this process that we're going through is really generating a lot of new information or validating things, but helping us determine priorities. So the goal of updating the Food System Action Plan was really to help us focus on targeting best practices that have emerged, especially through the pandemic, but also what's happened since 2015. A lot of innovation and a lot of movement especially by the nonprofit sector, to address some of our big systemic challenges. And then, of course, with the pandemic, where do we stand now? A lot of pivoting, but what's coming next? What are our opportunities coming about? We have some funding coming and just other initiatives and partnerships. And so we want to make sure we're positioned to be able to take advantage of those things. And then we really want to come up with priorities that are geared to very tangible, practical pieces that will allow us to create if you will, an investment strategy that identifies target projects, resources, capacity needs, and it's geared to help inform the community foundation for their own investments in the food system, working with their donors, but also much more broadly, the messaging and the advocacy to our state and local governments and philanthropy and other partners. We have huge challenges and assets, and we need much more investment in our food system. So that's really the goal from updating the plan. The Community Foundation, after the last plan, invested very significantly in the emergency food system and contributed to a lot of improvements there, which is one reason that the food system was more resilient in adapting to the pandemic challenges. But our undergirding mission here is to increase the vitality and resiliency of the food system as well. And so we want to identify some financing strategies and mechanisms to support this health promoting, equitable, accessible food system. And so what we're doing is a research process that includes updating some key data metrics, but also adding new information that's going to help guide and inform not just us, but policymakers and others that we want to support these investments in the food system. We are doing a series of convenings. As Grace mentioned, this is the 5th today. We applaud many of you who have been on several sessions, your stalwarts, but also welcome new people. So we're doing, the last one tomorrow is on the food economy. So we covered a lot of different topics to show the intersection of all these issues for a healthy food system. We're synthesizing all of this information in August, and we'll be presenting the draft action plan to the Community Foundation in September. And that's also going to be informed by a poll that Valley Vision is conducting with Sac State on the food system resilience. So we've been doing polling for the last few years, and this is the first time we're going to be doing a poll that's actually tied to a specific plan. So there'll be a lot of focus and information that will, I think, support the mission of our plan here. And then after the plan is submitted, we'll be working with the Community Foundation to look at some mechanisms for the financing strategy so that we can, have the next stage for carrying on. Next slide, please, Grace. So wanted to give you a quick update on how we're coordinating with other local and regional planning efforts. So we are in partnership with a lot of other groups to make sure that we're aligning, sharing information. One of our goals is to provide information too that other partners can use for things like their own planning or their proposals and financing strategies. So Brenda is on the call today. We're working with the Sacramento Food Policy Council on their food assessment, and they're working with the County of Sacramento on the environmental justice element. So that's going to be a really valuable process, and we're coordinating closely. We're also working with the Building Healthy Communities and the Healthy Food for All Collaborative. That is a group of nonprofits primarily in South Sacramento, but in other areas, that was funded by the California Endowment The endowment had a 10-year investment in building healthy communities. And so we are looking at retrospectively what's been learned, where do we go from here, and how do we build on the assets and the capacity that we've been built. So Sean Harrison from Soil-Born Farms is leading that effort. And then as Renee DeVere-Oki mentioned, we're also working with SACOG. SACOG has a grant from the state Sustainable Ag Lands Conservation Program. So it's updating all the great work that SACOG has done over the years on rural urban connections to really create a strong and viable agricultural economy, and updating a lot of the tools on that. And then Yolo County has a parallel plan that they're working on, coordinating with SACOG. And then we've been learning about new projects as we're going along. The Delta Protection Commission is doing work that includes ag viability. Valley Vision and other partners like the Metro Chamber, SACOG, and the Greater Sac Economic Council are working on a regional prosperity strategy that includes a big focus on the food and ag cluster. It's a major economic driver, and that strategy positions us to get federal funding support for several of our initiatives. So, and then we want to learn more about any regional or local planning efforts that we should be aligning with. Next slide, please, Grace. So today, this session, as you all know, you're all signed up. We're going to look at health status, nutrition and healthy eating, also food and ag education and literacy, including cooking, gardening, agriculture, and science. And some of this also is, having awareness of where our food comes in the community and learning skills so that we can be strengthening our communities and our residents, and then also other topics to include are culturally appropriate and traditional foods. And I want to thank you, Sean, for joining the call. We've been working closely with Santana Diaz at UC Davis Health on the culinary medicine approach, and really he's been such a leader for us on partnerships around institutional procurement and supporting local farmers and bringing healthy food into the hospitals. And we've been talking about, how do we making a lot of assertions about healthy food and outcomes, and how do we document that too with the science behind that. So really happy you're here today. Next slide, please, Grace. So some of you have heard this already. I'll go quickly through, but today's food system, here's a snapshot. We have this food and ag cluster, which comprises many pieces. It's ranching, forestry, farming. It's what comes off the land, what's the food processing and other value added, packaging and distribution, and support services. It's a major regional economic driver. The output from this whole sector is more than $12 billion, and that has more than 55,000 jobs. It does not include retail, hospitality, and tourism, such as our grocery stores, represented by Raley's and Nugget here today. Doesn't include nutrition services, hospitals and schools and things like that. So there's a lot of more to our food system that's just in the basic numbers. And it's such an important part of our regional economy. We have a very beautiful Mediterranean climate that produces high quality food, one of only 5 in the year. And a great deal of our land in the region is in working landscapes, and our number of farms is holding pretty steady, unlike some other regions, which is good. Next slide, please, Grace. We have a lot of challenges in our food system. One is a workforce challenge. The average age of our farmers is more than 57 years. Many of our producers are new in beginning, but the average age of these farmers is 46 years old. It's hard work, takes a lot to get into farming. We heard about some of those other challenges in some of our earlier sessions. The average age of a highly skilled manufacturing worker is 56 years. So that's with our food processing and other facilities. So we have a lot of efforts to try to create and support a skilled workforce and opportunities for upskilling and income mobility. Our ag looks a lot different across our various counties. For instance, El Dorado and Placer counties have a much higher percentage of smaller farms compared to Yolo and Sacramento and some of our other areas. Broadband access is a big issue in our rural communities and farms. We not only need internet for e-commerce and the business that would allow all of our farms and operations to connect in our more rural communities. But it's really important for farmers to be able to adopt the benefits of technology, including for making ag more sustainable by reducing water, energy, chemical inputs, and helping reduce the burden of farm labor, the taking over some of the less safe jobs, especially now we see our farm workers so subjected to heat stressors and other issues. Next slide, please. So we have this conundrum, we have great food assets in abundance, and we have huge levels of food insecurity and nutrition insecurity, even pre-COVID. 1 in 6 children was food insecure, and now that number is higher. This is Sacramento County, but I know that Michael is seeing these numbers and Raj in other regions, parts of our region. And even beforehand, food insecurity numbers were higher in our region than state and national averages. So this is a structural issue that we have had a lot of conversation about. And there's a growing emphasis on nutrition security, because even if you have access to food, if it's not healthy food, you're not contributing to your health outcomes, as was noted earlier. Our food banks have handled huge increases in millions of pounds of food distributed, meals, and people served. The emergency food system has been heroic, stepping up and really trying to meet this increased need very rapidly, including dealing with infrastructure issues and staffing issues, because a lot of the food system is served by volunteers. Our CalFresh enrollment of eligible participants ranges from 35% in Yolo County to 81% in Sac County. And we did find out, I was not as informed as I could have been, but some of this gap in Yolo County is because students are not included at UC Davis. So we really love to work with partners to address food insecurity on campuses. But if we were able to meet this gap of getting eligible people enrolled, it would generate more than $150 million annually in our economy for farmers and food distributors and others. So it's another area of focus. Something that the Yolo Food Bank especially has been working on is that almost 40% of our food is wasted somewhere along the chain. And there are opportunities for food recovery with new state legislation, and Yolo Food Bank's already been a leader in that. There are challenges for that on how the cost will be allocated and paid for. So that's an opportunity and an issue. And then just to mention that we're really trying to focus on institutional procurement by schools, hospitals, and others of local purchasing. It drives a lot of revenue into the economy. And we've got some great partners such as Sac City Unified and UC Davis and others that are working on that. So that's another strategic priority. But undergirding all of these are the growing environmental challenges that we're all facing. As somebody noted last week, half the world seems to be flooding or burning up. So has huge implications, of course, for all of us, but also for the resiliency of our food system. So a lot of focus to deal with the climate impacts and leverage some of the state and federal resources that can help us in those areas. So the next slide, please, Grace. So to set up our conversation for the next part of the meeting, we wanted to just recap a few challenges and opportunities. We know you're much more informed about these, so these are just a few topical points, but we do know that poor food and poor eating habits or access to food or affordable food does contribute to poor health status. Chronic disease is very tied to primarily to health of eating and food, healthy food, and exercise or physical activity was noted by Sean. So what are the challenges that we do have in the understanding of the nexus of healthy food and nutrition, or helping people understand and get the tools they need to have more food literacy or nutrition literacy? Also in the region, oftentimes there's been a gap in the knowledge that people have about where our food comes from, and just, the need to support agriculture and our farmers. And then a major issue about healthy eating is the lack of access to healthy food and the affordability of healthy food. And we talked about that somewhat yesterday in our session on food and nutrition security and access. So they're all intertwined, but some of our opportunities are the institutional focus that we have on healthy eating and nutrition from our schools and hospitals and others. And as you heard Michael and Raj talk, our food banks are really focused. It's not just getting food to people, but it's improving health outcomes. We have lots of innovative models around food literacy, ag education, urban ag, urban farms. Some of our partners are on the phone today or the call. We've got Center for Land-Based Learning, Soil-Borne Farms, Alchemist, Food Literacy Center, and others. So really making strides in this area of helping people understand about healthy eating and food and ag. And then we have strong partnerships to reach underserved populations. And it's really come through over the last sessions how great our community is. We have so many other resources. And I didn't want to underestimate too our public sector partners. I know University of California is on Co-op Extension and others that really, county offices that are really working together to try to create a healthier community and reduce hunger as well. And then there's the CalFresh enrollment efforts that Alchemist and others like UC Co-op Extension are working on. So I don't mean to exclude anybody. And I also want to acknowledge all the work that our private sector partners are doing, like our grocery stores, Raley's and Nugget are just tremendous leaders in this space and supporting so many of us in the nonprofit sector. So I think we really have a great foundation to address some of these challenges. And with that, I'm going to turn it over to Grace. Thank you.
Thank you, Trish. And we are once again going to use the Mentimeter service for the remainder of the meeting, actually. And so I do want to note that all of these responses are anonymous and you can submit as many entries as you want. So please be detailed if you can and honest with us here. So the first question is, in our region, what are the biggest challenges related to healthy eating, nutrition, food and ag education, and literacy? And Michael, I don't know if you are able to unmute and kind of talk about the challenges with SB 1383 that you had just referenced in the chat, if you kind of want to expand upon that.
Sure. So there's, edible food recovery has been going on throughout the state, the region, the nation for many, many years. It has always been funded almost 100% through private philanthropy. And private philanthropy can be somewhat cyclical. So sometimes there's a lot of edible food recovery going on because there's plenty of funding, and at other times, not so much. With SB 1383, theoretically, it requires that local jurisdictions fund that service. If they do choose to fund that service, that then frees up those philanthropic dollars for food banks to redirect it to be able to purchase fresh produce from fresh locally grown produce so that we can distribute that to residents of the region who simply financially cannot afford to purchase those items at the grocery store. Instead, they settle for purchasing lower nutritional quality type items. That funding also allows us to reach further and deeper into neighborhoods to make them aware of services that food banks and our partners provide, such as nutrition education. It just really creates a whole bunch of opportunity for us to advance nutritional security throughout the region. We're not able to do that right now because we're handcuffed with having to fund the expensive edible food recovery programs that we have.
Thank you, Michael. Does anyone have any other comments that they'd like to make, maybe expanding upon some of the challenges that they listed here, or in response to Michael's comments about SB 1383? We see food access coming up here too as some of the biggest challenges. We did discuss that yesterday, and all of it is connected. Also see a theme of lack of cooking skills or programs that target low-income groups for cooking. School curriculum that needs a greater focus on nutrition and physical activity, making healthy food attractive. I know I grew up with Brussels sprouts being, the most disgusting vegetables, and I love them now. So
maybe this is a point where Amber can give us a few insights here too, given your mission and your work. And sometimes probably the children are more open to vegetables than the adults.
Absolutely, Trish. I actually just wrote that inspiring kids to eat their vegetables is the easiest part of our work. And I think that gets missed oftentimes, that, certainly there are a lot of barriers, but many of the barriers are actually at a higher level around funding, like this call is specifically addressing, around understanding of like electeds. I definitely found there were a lot of opportunities to offer learning. And during the COVID crisis, I felt that well, and not just since COVID, I would say since the last recession, that emergency food is something we understand. People are hungry, give them food. And the rest of this work is much more complicated and upstream. And I think it requires a leaning in. I have definitely seen a lot of awesome work by foundations locally to understand this work. But I think we still have a long way to go with elected officials and so on, really helping them to understand the nuance and the differences of all these barriers and how the upstream work could create long-term economic benefit, health benefit, benefits to the environment. And a lot of that gets lost. So hope that's helpful.
Yeah, that's a great point, Amber, because the emergency food system is on the front line, and when there's a crisis, the system's even more impacted. It's a reactive piece, or it's a stressor for the emergency food system, but all these pieces are working together. And so what you're talking about is those other investments that we need for the long term as well as the short term responses. And I know that the food banks are also trying to build in those education pieces, but I think the pieces that you're doing with the schools too is really, really great, reaching the kids.
I want to add something here too, is I think a lot about the general public doesn't really understand what food security is, and that the need is beyond the emergency food system. And that's important because these are the people that will vote. There are people that will talk to their legislators and support the food assistance programs that as we need them to do. So I think there's a lack of understanding in the general public about these issues. And so it's not just about programs that reach the poor in terms of nutrition education and science literacy. We have a lack of that in all populations, and that's what's causing a big problem for us right now. It's causing a problem with COVID vaccines, and it's also causing a problem in the food and nutrition arena.
Thank you very much, Lucian. I hope when we get to the next stages of the discussion, we'll get some good suggestions and ideas for strategies that we can implement to address some of this overall lack of knowledge. It's amazing. A lot of times we live in an agricultural region and people don't know where their food comes from. So, and that's critical for us to be able to support keeping our ag viable too. If you don't know how important that resource is, there's, how do we stop the pressures of land conversion and things like that too? So thank you. Okay, Grace, I'll turn it back to you.
Okay, I think we can go to the next question here. So we talked about challenges, and now we kind of want to do a different scale exercise, talking about how effectively the policies, programs, and resources are available in the region to support healthy eating, nutrition, food and ag education, and literacy. So these are statements, and you can kind of do the scale on 1 to 5 of which one, where you feel the region is on the scale. The second statement is the region effectively provides access to healthy eating, nutrition, food and ag education, and literacy. So the first question is kind of about supporting that, and the second one is really about providing that access. And that kind of embodies cost in there as well. Does anyone have any comments they want to share about maybe why they chose a certain number or anything to expand upon? Looks like we're below 3 for both of them, kind of at the 2.4, 2.5.
So at Yolo Food Bank, we're very focused on outcomes and impacts. Doesn't mean that we're as successful as we would like to be. But I think when you think about theory of change and the things that you would be seeing if we were really delivering on policies and executing policies, the outcomes would look very different, right? We wouldn't have 1/3 of the families in the region unable to meet their basic needs. That's a pretty clear indicator that the policies either don't exist to support those families, or they're not being properly executed.
It's interesting too, in the other scale questions in the other sections, most of them averaged around 3, except on this one and the food access and food yesterday, food security. These are the 2 areas where we're falling below even half. So I think, Michael, to your point, there's a lot to unpack here, and we're not doing that well. We need to do a lot better here.
I would add that the need far outweighs the available funding to be able to meet the need. I mean, there's no way Food Literacy Center can scale fast enough, and it's very, very difficult to keep scaling because the need is just so huge, and there's just a need for more food literacy centers, and yeah, we just can't train and educate people fast enough, and there's not enough funding to be able to do that.
Yeah, good point, Amber.
Trish, I have a question as a scientist,
yes.
Especially a naive scientist. I always get into trouble in these sorts of gatherings, but you'll all be kind to me, I hope, today. Yes. So, one of the things I always wonder about is, the etiology or the basis for the numbers. So people will say numbers and they'll say, clearly we need a change in policy, or clearly we need more money, or clearly we need whatever, because the numbers look bad. And I always say, that all sounds good. Maybe we need new policies. Maybe, we need more money. But my first question is, why do the numbers look the way they look? And so I feel that to solve the problem, you need to know the etiology, right? So if you build 3 new facilities, is there data that clearly show if you do three new facilities, you're going to improve the metabolic health of Yolo County? If the answer to that is I don't know, then we need to maybe think about other things. So for example, at the community level, at the individual level, at the personal marketing level, if you will, is the messaging getting to the folks correctly to access existing resources? So it's sort of a consumer-based question that I get in a lot of trouble for asking, but I don't know what this group thinks of that.
I could help answer that, Sean. I would say yes. We don't have any problem reaching kids. We're going into schools where they are already there. And I would say that what you're asking about this data, the field of food literacy, food education is extremely young. So for example, I've worked in domestic violence nonprofits. There is a national rubric that you can use to measure outcomes that academics have vetted and everybody uses. We don't have that in food literacy because it is so young a field and we're all trying to make it up as we go along. They're finally at the policy level, the state has finally prioritized this and said, yes, the need is so great that we as the state of California are going to create a farm to school department in the in CDFA. They got a bid to find out what it would cost to create a tool that all of us could use across the state to help measure the outcomes of food literacy. The price tag on that is $1.2 million. That's the quote they got. So that is why none of us really have, anecdotally, we could give you lots of data, but it is very expensive to get that kind of academic measurement, which draws funding, right? So chicken and egg right there. But yeah, would love to talk more with you offline because I feel like we could have a fun conversation.
Amber, I appreciate that. That's great. It's one of the reasons I'm on the call too, is just to kind of wrap my head around this sort of thing. And I do have some very good friends and colleagues back in Arkansas, which was my previous position before being recruited here, who are also expert in implementation science. That's the other portion of it. If you don't implement the policy or you don't implement the intervention appropriately, and you're not measuring the implementation success, it also becomes very cloudy as well. I've learned from her. So yeah, thank you so much.
Sean, it's a great question, and I'm going to pose it back to the audience. Also, you know, we have a lot of policy variability. There isn't consistency. So we might have no policy, or we might have good policies, but they're not implemented, or we're operating in a realm where even it's hard. I know this is something Brenda's working on for the Food Policy Council for the county, is what is the policy realm too, and how is it applied? And do we have the policies that we do need? Sometimes the policy focus gets a little bit lost, but then the data side is the other side that you're mentioning. And when it relates to doing outreach and reaching people that you're trying to reach with information, how successful are those mechanisms? So I'm going to ask some of the other people on the call who are on the front line for some thoughts on that.
This is Brenda from the Sacramento Food Policy Council, and I'll answer a little bit the question on wearing my other hat as a culinary nutrition education instructor. So I wonder if it wouldn't be useful. I don't know how many, I know Stockton had a minimum basic income. In one of my, maybe like 3 years ago with some students, I encouraged them to, you know, continue cooking over the summer. They had a really awesome year. They contributed a lot to the discussion in class, and were just like, you know, those top-notch students that participated really well. You know, here's copies of the recipes, keep cooking. You can riff on them, make them whatever you want. You know, this is so awesome. Come get food from the garden, blah, blah, blah. And it was met, my encouragement was met with a lukewarm. And what the students expressed to me was that they don't have autonomy or purchasing power in their home. So unless we're doing whole family education or giving families and tools to then do something with what they learn, kind of a little bit to the consumer science question is, if folks have dollars in their hands, what do they do with those dollars, you know? So I think it's an important, I wonder if the regions that have done minimum basic income have done any questions on food. And I think, yeah, I think it'd be worthy to kind of explore maybe with the National League of Counties or National League of Cities to see what other folks that are doing either MBI or versions of an MBI that have had an impact on nutrition support and food. So that'd be I think, I don't know if that's something in your scope of inquiry, but definitely we'll be exploring it in the food system assessment. And then to I guess the policy piece, it's in its nascency, because it was the newly adopted, but SB 1000 in California, we believe to be a very powerful tool. It's legislation that requires jurisdictions that are updating, I think, one or two, minimum two elements or more in their general plan updates, to also at the same time have to adopt or create and have a plan for implementing environmental justice. The thing about the environmental justice element in any general plan updates is that it's cross-cutting. It addresses the built environment, public safety, active and green space, even criminal reform and food access. So there's a minimum set of and food security. There's a minimum set of areas that every EJ element must explore. Food is one of them, but it's also cross-cutting. So you can put a lot of dollars in one department, but if you don't have safe and sanitary housing where people there's some responsiveness, with the landlords to make sure that the appliances are safe, that there are stoves in every apartment, that the HOA policies, the homeowners association policies, don't prohibit gardening. We've seen some policies concerning that in HOAs where folks can't grow certain plants, and your front lawn has to look like this, and no, you can't have a garden box in the front because bees or whatever. So the EJ policy is not a panacea because it's so nascent, but it's something that we're using to great effect in Sacramento County, and I'm excited to see where that will go. And something that we'll certainly explore in the food system assessment that we're conducting, just because it has this cross-cutting nature to support community health overall, the built environment, as well as some programmatic pieces on health and food.
Brenda, thank you. That's a great point too. I know that the Urban Land Institute several years ago did a whole series on healthy communities and increasing health through supporting food and ag. And it was things like looking at local policies in the built environment, like can you do an urban ag or farms or things like that? Or do you have access to local food sources? I know, Sarah, one of the things that you've been working on in West Sac with the urban ag program is really, it's got so many dimensions to it. Maybe you could just highlight that again, because each time you talk, I learned something new, including, your food access and healthy food piece.
Hey, can you guys hear me?
Yeah.
Sorry, I was actually trying to catch everything you said, and then my headphones came unplugged. So, could you just repeat, what was it about the urban farm program that you'd like to understand?
Well, one of the things, Brenda mentioned was how looking at local policies. So if your local ordinances don't allow you to do those things, but now you've actually got a formalized program with the city that's leveraging vacant parcels and allowing you to increase food access and learning. Yeah,
absolutely. Yeah, I can say, I think it's kind of interesting. I mean, whether or not it's because West Sacramento is such a small city that it just sort of moves at a quicker pace than Sacramento right now. But, West Sacramento does not have a formalized urban ag ordinance. It doesn't have anything even close to the level of sophistication and detail that Sacramento County came up with when they did their urban ag ordinance, which I read in full and was so impressed with. For West Sac, the policy that we talked about and discussed when the program started in 2014 was that they were opening up urban ag to all zoning. So just by doing that, we never even really had to have much of a conversation about whether it's allowed here, there, or anywhere. And at the end of the day, only one of our sites is actually on city-owned property. The rest of the sites are either on private property or private developers, a low-income housing property, a school district. Yeah, and then of course, like I said, one of them is on city-owned land out of the 5. So yeah, it's just been a major attitude of openness in terms of city council and the mayor. and the city manager, obviously, in supporting the urban ag program and writing a statement with about 12 points in which they're committing to supporting it for another 10 years, which was released in 2019. So yeah, even though we don't have a formalized urban ag policy in West Sac, they sort of just blanketed, avoided that by saying that urban ag is okay in all zones.
Thanks for that update. So lots of things to think about here. And I want to encourage everybody to be looking at the chat. There's a lot of good information that's being provided. And, you know, also just the conversations are so rich across all of these sessions and so much is coming out of it. We want to commit to keep these conversations going and this information sharing and partnership building. So thank you. I'll let Grace go on to the next. Oh, we are on the next question, our strengths and assets. So we have a huge amount of assets, I think, here.
Yeah, so the question is, what are the region's strengths and assets, programs, best practices related to healthy eating, nutrition, food and ag, education, and literacy? So Sarah just shared the West Sac program and some of the urban ag elements there. Does anyone else have anything to share about some of the region's strengths and some best practices or programs that, you know, other cities or communities can model?
Alex is on from CDFA, I think, California Department of Food and Ag. Alex, are you still on the call? Oh, I'm sorry, Amy Garfinkel. I was thinking of Cal Recycle. Sorry, Amy. Could you just weigh in a little bit on the farm to school? What's going to happen now with the resources for that as well?
Hi, everyone. Sure. So we have currently 60 grantees for the pilot farm to school grant in California. So the grantees include school districts, some charter schools, county offices of education, nonprofits, and some other organizations, all working to increase procurement and purchasing of California-grown, healthy, nutritious food from California producers, integrating those foods into school meals and taste tests and other educational activities, and then also trying to integrate educational opportunities in cafeterias and classrooms and on school gardens and on school farms and in culinary programs and other culinary and agricultural pathways, trying to integrate that together with the school nutrition program so that students have this full circle understanding of their food system and where their food is coming from and all of that. So really impressed and amazed by all of the grantees and so excited that we get to work with them.
And I think you've got a big budget boost, is that right? Coming up?
We're not sure yet. Yeah, so it should hopefully be figured out, I think in the next month or two. And if that piece of the budget goes through, then that would be about $30 million to run another round of the grant program. And that would hopefully open up again in the fall. So I can put my email in the chat. So if anyone wants more information about that or to be kept updated about that opportunity, I'm happy to chat with anyone about it. And then also we're trying to develop that opportunity. So if anyone has feedback on, on the development of the grant RFA, would love to talk with you and hear your ideas.
Great. Thank you so much, Amy. We will definitely take you up on that.
Great.
Mm-hmm. And you can see some of our farm to school programs are popping up here, and we'd love to get those programs more deployed across the whole region. Sac City Unified has a new central kitchen. We'll be talking about that a little bit tomorrow. It's a phenomenal site. I had the privilege to tour it. It's a very sophisticated facility, and they're able to do some level of food prep and processing too, even beyond the cooking side, and they can generate some revenues that way. They're going to they're in discussions to become a vendor for UC Davis Health so that they can aggregate their purchasing power. So there's a lot of things that we really can do working on all these different levers. we got to see some of their food purchasing and their buying from Yolo County farmers and others. So lots of opportunities there. Okay, Grace, you ready to? Yeah. Well, we have a lot of assets here, so and models as well. So,
and this is similar, but any success stories about resources, initiatives, programs that relate to that? And we won't spend too much time on this one because it is kind of similar to the other one, but again, any success stories about a program that worked really well?
Just to note, we do want to highlight some of these in the, not only in the plan, but we, to the points being made about people not knowing a lot about the good things that are happening or what the impacts of these things are. We want to tell some stories. We want to be able to communicate out to elected officials and community leaders and others about why it's important to support these kind of initiatives and what the partners are already doing that could, you know, have these longer term as well as short-term impacts. So.
Trish and Grace, this is Brenda. I'll share it verbally.
Okay.
I'm being challenged with the Menti, or my fat fingers on my phone, on my little phone screen.
Yeah, technology is not always made for all of this kind of input, Brenda. Thank you.
I think a great story to highlight would be something that we're doing at Grant High School, and I don't know what it's going to look like now, and then we're expanding it into Luther Burbank as well, is creating jobs for young adults in the food education space. So to implement a programming at Twin Rivers Unified that's hubbed at Grant High School, we needed lots of hands to be the garden educators, and then also the sous chefs in the kitchen to help instruct the hands-on cooking sessions with students. So in partnership with Health Education Council in their previous SNAP Ed grant, and then going forward with Twin Rivers, and I think they wrote it into their LCAP, was for another nonprofit to be the receiver of dollars to pay the youth to be the mentors. And these were graduates of the Geo Academy, so they already had ag and natural resources education. So you think of, you know, we put lots of resources into CTE, they graduate, and then what do they do with the stuff that they learned? You don't know if they're gonna, you know, go be marketers at Walmart or whatever. So this provided a job for those young adults that were getting their sea legs under them about going to college or see what they wanted to do with what they had just learned in high school. And those first years of being an adult on their own, to have a steady job in the neighborhood where they live in a thing that they already knew how to do. And we paid them pretty well and pretty, I think, a great rate. $1 over minimum wage, increasing every year. So this year they would be getting $15 an hour if we start. And so we always bump it up because right now a lot, you know, we're competing with fast food jobs that are paying $16.50 to start. So, but it was a great success story. And over the years, we've had probably 24 young adults come through the program. So we exercise our alumni network of graduates to stay in the neighborhood. A lot of them saw their cousins in the elementary schools that would come, or they'd be back on campus, they'd get fingerprinted back and get job training. We did some classes on financing, and we'd have leadership within the team to develop their own curriculum units that they would teach that was in alignment with the other parts of the program. So they really were the creators of the program. We met weekly and they organized weekly to make sure if someone got sick that they'd have coverage for the units, and I would just basically supervise. So again, I think it's a little bit different, but on the MBI, I think if we put dollars in folks' hands, it really helps extend the education further, because then they're able to implement what we've been working so hard to show, to put in front of them. So yeah.
Thank you, Brenda. We got that down. That what you're mentioning too about the students as mentors, really, this is part of the other part of the education is having youth, first of all, learn more about our food system, not just about healthy eating, but the whole bigger aspect of our food system, and even see it maybe as a career opportunity later. Because the other day we were on the call with the city of Sacramento. They do the biweekly food access call, and so many organizations on there have needs for staff too. And so seeing all these organizations as ways that we can be part of our food system in a lot of different ways. I know the food banks have had a lot of challenges because they've had a lot of volunteer workers, and that's really changed with the pandemic, but distribution sites are changing. Nutrition services is a great area, at schools and hospitals. So thinking broadly about knitting all these pieces together. And I think we've been gathering information too about some of the innovations that are going on. So thank you for adding all this great background here. Grace, ready to go on?
Yeah, thank you, Brenda, for that. That was really great. And that would have been a lot to put in a Mentimeter box anyway. So thank you for verbally sharing it. So next we have, what are some emerging opportunities that could help strengthen the food system? So given some of the challenges that we discussed and some of the, emerging strengths, some of the strengths that are in our region, what are some emerging opportunities that could help strengthen? Regional food hubs. I believe Yolo County is working on a food hub. Michael, do you want to talk about that at all?
I could, but the expert is sitting right next to you, at least in my frames. Trish knows much more than I do.
Oh, well, thank you, Michael. I want to give props to SACOG, because many years ago, SACOG did a big project looking at the opportunity for food hubs in the region. I was privileged to work on that project. Was a lot of great work. We worked with USDA and many federal and state partners. And the opportunity for food hubs isn't just to aggregate food, but to add more value that we saw that would help increase revenues for producers and distributors, but also help meet needs for things like schools that don't have central kitchens. So what are the kind of levels of food they need? At any event, we documented that it's a viable model, and it's taken a while, but we're really happy to report that Yolo County partners, including the food bank and others, did submit an application to the county for the recovery programs, but also we submitted an application to USDA to support a food hub in Yolo County, which would be great. It's a food epicenter with so much of the production there, but also being able to aggregate and get food to schools and other partners. So we're really hopeful that that's going to go through. But just to note that there is an opportunity across the region for more than one food hub. And it's backward working too, because it helps farmers know how to connect into markets and plant for markets and make sure that they have certification for healthy foods and things like that. And Sarah actually, so Mike, I don't know if you want, Michael, if you want to say anything more, but also Sarah Bernal in West Sac, I think you have created a small hub for your, because you've got enough produce coming off the farms. Is that right? I don't know if you can hear me, but.
I think Sarah might have dropped off.
Oh, okay. So it's a natural evolution. And Michael, maybe you could just say why you think the hubs are important or the value that they're going to add, because we want to encourage them across the region.
Well, as a food bank executive director, the really significant thing about a food hub is potentially will secure a steady supply of locally grown produce for community members who simply cannot afford to purchase that product in a grocery store. And so right now, the supply to food banks is highly variable, particularly in Yolo County, where in the winter months, it's super challenging to access locally grown produce because not much of it is being grown during that time of the year.
Mm-hmm.
The food hub will completely change that dynamic where we would have a steady supply that we don't have right now. And then, of course, the second thing is it supports the local farmers. And the stronger the local farmers are, the stronger everybody else is, right? The more robust the food system is, the less we're having to purchase product in Australia and ship it to California and being consumed. I mean, that's just all crazy. So the more robust the regional food system is, the more resilient it is, the better everybody is, particularly the most vulnerable community members. So that's why we're super excited about this this concept that's been presented to the county with, I don't know, 5 or 6 partners. I hope it really goes somewhere.
Yeah, me too. So thank you, Michael. There's a lot of good ideas coming up here, and we're getting close to our time, but one of the things I wanted to comment on that I see here, converting vacant lots to community gardens. We've looked at programs in some other cities, and Sacramento does have a community garden program, but sort of a more intentional strategy to repurpose that for community gardens and urban farms. It takes funding to do that. It takes funding to convert properties to be healthy, sustainable plots with infrastructure, but it's another sort of investment area. And when we talk about project potentials or things to come up into the investment strategy, thinking about any kind of project like that, we got some information from Alchemist about what it would cost to do the CalFresh program EB at the farmers markets. So that's good. The more tangible, the better for some of these things that we're talking about. Other things like the Farm Bill, that's a policy play that could result in better funding. And through the Metro Chamber's Cap to Cap program, we're working on food, nutrition, and security policy request. We're going to be doing some work in the fall with USDA and others. So really encourage you to be in touch with us and how we can integrate ideas. We're working with Sac City Unified on that partly, also allowing flexibility so schools can use their funding to get direct funding instead of cash in lieu to purchase from local growers rather than from the USDA commodity. So I think there's a lot of things we can do to improve local sourcing and healthier food. And the next is, Sean, would be proving that in fact local grown food is healthier, does contribute to health outcomes. It's another area of research we've talked about.
Hey, Trish, if I could talk about the community gardens a little bit.
Yes.
There's several things that are happening in Oak Park. Landowners are allowing some community members to come in and convert vacant lots. And so it is much more affordable as kind of a way to do that. If the landowner is the infrastructure is there already, so the landowners can come in or can basically gift it to the community to create a garden. The city garden program, I'm working with them at they're going to be the owner. They're the owners of the Mirasol Village Garden, and what's interesting with that is it has to follow the same guidelines and rules as all the other city gardens, which means it's $50 a year for a plot, which means it might not be accessible to those who we really want it to be accessible. So there needs to be discussion about the community gardens and who they're accessible to. Currently, the Fremont Community Garden has over 100 people on the wait list.
Yeah.
So if we go, and the 19th Street Garden has 25 people, that's a private community garden. If we go in Marisol Village, we have 60 plots. If the city opens it up to all city residents, are the 100 people on the wait list at Fremont, how many of them are going to come and take plots at Marisol, limiting the access to the residents?
Yeah, good point. Well, you raise a lot of other corollary things. Is could we in the city and other jurisdictions have a more intentional approach to identifying parcels that could be gifted, converted, go into land trust, or what other mechanisms could we be that embedded more in a strategy rather than kind of one-offs? Or well, you know, the work that you're doing is really important, but how could we help get that to scale and raise the visibility of the kind of issues that you're mentioning so that it's really a neighborhood resource as well? But the waiting lists show the demand too.
Well, and this last year showed a lot also. I actually started a nursery because people couldn't buy vegetable plants anywhere. And I had a bunch of seeds, so I just started growing and selling. But the part of what we're trying to do also is invest in the community where, say, our Pansy project is, by reaching out and trying to hire someone locally to be our maintenance person there, to kind of be our watch person who will keep an eye on it. That way we're not like just this entity coming in, doing this, and then telling the community how they need to do it, but we're investing in the community by offering some opportunities for a paid position as well.
Yeah, more job opportunities and entrepreneurship opportunities in the food system. A lot of good information coming up here on the grid. So thank you very much. And going back to the question of education and community and public health, I mean, I think we need more discussion about that too. The good models and approaches to support all the good work that you're doing. So Grace, you want to go?
Yep, we'll go to the next one
Yeah,
here.
go to the next one. Thank you.
So this is really about funding. So what are the main priorities for funding and capacity needs? We've heard a lot, you know, that the Food Literacy Center, you know, can't be scaled fast enough. And there's definitely a lot of need for, you know, more farm to school programs and community gardens I was just mentioned. And so what are the main priorities if this funding, you know, were to come in?
This is your chance. This is what we need to get into the strategy. And we please encourage you to send more ideas and information you have. Grace is going to be sending out the summary and for all of the sessions, and we're going to be synthesizing the data, but really for follow-up. I know you'll be thinking about some things afterwards, so please let us know and get this into us, or Grace will send out a survey form so we can get any added things. But this is really something we want to elevate as part of the information back to the foundation. And externally, like we said, it's our investment strategy back to the community and to funders, and to say that we've got a strong list of things that are ready to go. We know our needs. We want to really promote those.
And as Trish mentioned, there will be a survey that's sent out with all of the recordings and notes after these conclude this week that will allow folks to provide additional feedback, or if you weren't able to attend a session or had to leave early for another session, you can still provide your input through that way. Of course, we'll always accept input through email as well, but that'll kind of be a streamlined survey available for you once the recordings are sent.
And feel free to, you'll see in the next question too, but feel free to send us any specifics too, if you have funding amounts or projects that are ready to go, shovel ready or whatever, or just if you have some estimates, that will help us as well. Okay, Grace. Yes, unrestricted dollars, holy grail. A point has been made over these previous forums too, that, you know, how difficult it is to apply for some of these, you know, kind of more formalized programs, especially at this federal level. And it constrains our ability to be creative and flexible, which we've had to do, especially through the pandemic. But how do we get resources into our food system? Thank you, Michael, for that. Okay, Grace, you want to go into the next one? We're getting down to the end here.
All right, so this question is, what are the main priorities for current or future projects or programs that the Food System Action Plan can help address? And feel free, if there's anything else you want to share, you know, you can plop that in there and we'll capture it.
I want to also acknowledge the Rayleighs, the Food for Families, all the great work that you're doing, and Nugget as well, that we're really lucky to have our partners in the grocery business private sector side as well, that we've got a lot of great partners across the whole food system. And commenting on Michael's note there, just want to acknowledge that as well. So
all right, and I'm going to, oh, sorry, did you have a comment, Miriam?
Yes, thank you for allowing me to speak up. I'm a retired registered dietitian from UC Davis Health, and Grace and I spoke on the phone a while back, and I'm so thankful for listening and just joining in, just a person who has worked so long and in the healthcare and as a provider. And I enjoyed everyone's comment and all the information that's provided. And I am so thankful to hear all this program available. One of the challenges that as basically a healthcare provider, and we see patients on the other side where they are ill and they're seeking help and they're coming for care, is that literally it's a complex situation where people probably were not fortunate enough to have access to education. So it's become like a cycle, and people who didn't have the knowledge, then, you know, how they would provide the knowledge to the kids and just so on. But as we all know, it's a complex situation where the lack of funding, lack of income, lack of education, lack of access to transportation. And one of the things that as just an individual now really comes to my mind is that access to just simple moms and pops store in the neighborhoods. And it's really wonderful to have the grocery store that are, have all that's in the big buildings. But how about people who live in a area who don't have a grocery stores? I mean, we can drive in different communities in Sacramento and maybe beyond. Literally, you have to go so far to get to Rayleigh's, to get to nuggets. And I'm not singling anyone at all. I respect all the programs that's available, and I'm just so happy to hear that. But what's happening to these small stores that no longer may be possible for them to continue their practice, so they can be selling just foods that people can walk to, just like in the past people would go to store every day and buy what they needed for the day and eat fresh and eat healthy, or eat once a week, buy groceries and just cook their kids and that. So I'm just making a comment. I just wonder, how's that possible? Or from all the resources, I know in the past I had heard that if people would go to farmers market, and I used to tell my patients that if you go toward the end of the day, it's possible, and they would tell me that they would actually buy food for less. And basically you kind of negotiate with farmers and get maybe $4 of apple for like whatever it was for the price, because farmers want to let go of their produce rather than hauling it back in the truck and taking it back to the farm. I don't know if that's true anymore. I should personally investigate in that. But what is happening to these small grocery stores in the neighborhood? Is there any way to support that? Because that's also very important. Thank you for listening.
Yeah, thank you, Miriam. Again, you're on the front line, and the food desert issue is, and food access in communities is really critical. And I think we're looking at some new models. That's the kind of things that people have talked about. Like we have a couple of mobile farm trucks now going out, and the urban ag and things like that. But definitely another issue. And all the things you mentioned are barriers to healthy eating and access. And I know we're at overtime a little bit, and I wanted to thank FUA also from the health system for being here today. We want to follow up with you because through the community benefit programs, I know that there's a lot of investment from the hospitals in our healthy food system. So love to catch up and get more data on that as well. So thank you, everybody. I'm sorry that we went a little over. Linda Cutler had to get off for a board meeting and wanted to just have us thank you all for being with us today. And we're really, really happy to have had the conversation with you. As Grace says, stay in touch, and we'll be back in touch with you. And we have one last session tomorrow if you want to learn more about food hubs and food incubators. And farm to school and farm to hospital. So thank you everybody again, and have a great afternoon. Take care.